Name is Dr. Quincy Muathe. I'm a chiropractor here in Ireland, and today I'm going to try something a little different. I'm going to have a little fun, walk into work right now, so I'm just going to go over a few not real cases, but just some made up cases, things that you probably see in a chiropractic clinic very, very frequently. And I figured, I'd take the time to explain some of my clinical thought processes, explain how I view things as a chiropractor, and just honestly have an opportunity to interact with whoever hops on. So before I start, though, I just want to take a moment and do a positive affirmation and just start with some positivity and just say, I'm so thankful that I have breath in my lungs. I'm so thankful I have energy to walk. I'm so thankful that God, the Creator, blessed me with good health at this moment in life, and that doors have been open and I've been allowed to walk through those doors, and I'm in the profession that I'm in. So before I go into any case histories, I just want to say I love chiropractic. I'm grateful that God gave me an opportunity to practice chiropractic. I'm grateful that I'm grateful that I'm in this profession. It is a humbling profession. It is a beautiful profession, and I'm just so grateful. So, without further ado, I'm gonna hop in. Fake patient comes to your clinic. 45-year-old male comes in with low back pain. He saw an ad on Google and said, "You know what? I've been dealing with." Oh, hey, we have people in the live stream. Hey, how are you? I'm Dr. Quincy Muathe. I'm a chiropractor here in Ireland, and what I'm doing is just going over a made-up case, going over a pretend case, just explaining my clinical thought process. And so yeah, I'm just gonna hop in. These are things that you would see on hello. These are things that chiropractors probably see on a daily basis, and something that I see on a daily basis. So, 45-year-old male comes to the clinic with low back pain. He saw your ad on Google and decided he would stop it because he's been dealing with back pain for years. So you introduce yourself, you bring him to the exam room, and you take a case history, and you start at the very beginning. So for me, I start with a history of present illness. So I ask where the pain was at, and he says, "Oh man, doc, it's in my low back." I say, "Okay, that's good. How long has it been going on?" And he says, "Honestly, I've had low back pain on and off for decades now, but over the past couple months, it's really been bothering me." He goes on to say that he works a pretty manual labor job. He works construction, and he does a lot of bending and lifting, and is oftentimes required to carry heavy things. And so I take my note of that, and I consider, what's going on, the driving factor, and then I ask, okay, so am I the first person that you've seen for this low back pain? And he says, you know what? I've gone to, I've gotten a few massages here and there, and it's helped, but I've never actually sought out anybody to, you know, try to get rid of this. So I say, okay, perfect. Well, if since this is your first time at a chiropractor, I say welcome. We do things a little different, but I have a few more questions. And so I ask, have you tried anything to make your low back pain better? And he says, well, I've tried BioFreeze, which is a topical analgesic. I've tried massage. I've tried heat. But other than that, I haven't really tried anything else. I said, are you taking any medication? He said, every now and again. He said that, and once again, this is a fake case. Said that I try every now and again. I have to take Tylenol if my back is really bad. I take Tylenol and I put some heat on my back. I said, okay. And I said, well, what makes the pain worse? And he says, well, when I go to work and I have to kneel down and pick something up, or when I you know, whenever I'm with the crew and I have to pick up heavy things off the ground, and I go from picking things up off the ground to coming back up, that really kills my back. I say, okay, well, that's interesting. And so that kind of drives my clinical thought process a little different. And I say, well, does it hurt to cough, sneeze, or bear down to use the bathroom? He says, you know what? Now that you mention it, I have to avoid sneezing as much as I can, because if I don't, it will kill my back. I say, okay. So in my mind, that lets me know there, and this is kind of like coming off to the side bit, that lets me know there's likely an issue, abdominal bracing, and there's likely a weakness in the low back, whether that be within the perispinal musculature, et cetera, et cetera. So I keep that kind of in the back of my head. I say, okay. And I ask, how would you describe that pain if you could put a word to it? Some people say sharp, some people say dull, some people say it's like, man, it's like I'm being stabbed with an ice pick. And he says, it's not any of that, except when I sneeze. If I sneeze, whoo, it hits. I have to gather myself, I prep myself, and then when it hits, I'm like, oh my gosh. I say, okay, that's good. But he says, otherwise, it's more of a constant dull ache. I say, okay, that's good to know. And I ask, is there any pain that's radiating down into your legs, from your lower back? Does any of the pain radiate anywhere? Does it go down or does it go up? Because you know what? No, it doesn't. Um, but when I sneeze, he says, I sometimes get a shooting pain in my back. I say, okay. Hello, we have more people on the live. For those who are just now joining, my name is Dr. Quincy Muathe. I'm a chiropractor here in Ireland, and I'm just going over a pretend patient history. So I started with a 45-year-old male coming to the clinic with low back pain, and that's now I'm going into some of my questions. So he says if he sneezes, he sometimes gets pain that goes into his leg, um, but it doesn't go far. It kind of goes into his butt cheek. And so I say, okay, that's interesting. Does it go down both legs? And he says no, because at this point, with this demographic, one of the things that I try to be aware of is the possibility of what's called Caudy-Quina syndrome, which is where there's cord compression within the low back, likely due to a disc. So I try to make sure that I try to rule out any of these red flag findings, which would be, saddle paralysis, erectile dysfunction, um, bladder and bowel retention initially, then the inability to keep it in. And so ask all my questions, and each one of those red flag questions is no. So I say, okay, he's in a safe spot, and he doesn't need to be referred to the emergency room for decompression. So we have pain in the low back that goes down slightly into the right buttock, and it's been going on for decades. But last few months, it's been kind of on and off. He's tried massage, he's tried heat, he's tried Tylenol, paracetamol, and still he's been dealing with this nonstop. So I say, okay, on a scale of 0 to 10, how would you rate your pain? And he says, you know what? It's a pretty constant 4 to 5 out of 10. But when I sneeze, I'm telling you what, it can get up to like an 8 or 9 out of 10. And so that's why I always have to brace myself. I say, okay, that's good to know. And then I ask, is it worse in the morning or is it worse at night? And he says, it's not really worse in the morning or at night. He says, when I get out of bed, I'm a little stiff, but nothing much besides that. And he says, other than that, it's just worse when I'm at work and I'm going forward and I'm coming back up. Hello, guys that are hopping in, people that are hopping in the chat. My name is Dr. Quincy Muathe. I'm a chiropractor here in Ireland, and I'm just going over a case report, pretend case report. So I say, okay. Then I go into past medical history and I ask, are you taking any medications? No, no medications. Occasional paracetamol. Um, have you had any recent hospitalizations, surgeries, traumas? No. He noted that he played sports back in high school, played a little bit of football, maybe got a concussion here or there, but nothing major. Um, and ask, social history. Um, do you smoke? Do you drink? Do you take illicit drugs? No, nothing's an occasional beer here and there, just for celebrations and whatnot. And then I do my review of systems. And so my review of systems is where I consider this my head to toe, inside out. So I ask, have you had any recent changes in your vision, your smell, or your taste? Oh, well, he says, I'm getting a little older, so my vision's a little blurry now and again, but nothing too serious. I say, okay. Um, have you had any difficulty breathing or swallowing, or have you had any chest pain? He says, no. I say, okay, very good. Um, have you ever been diagnosed with high blood pressure? No, haven't been diagnosed with high blood pressure. Have you ever had any spinal surgeries? No. Have you ever had a stroke? The answer is no. I say, perfect. And I keep going. I say, have you had any issues digesting any food or using the restroom? No, everything is fine. Then I ask, have you had any numbness or tingling in your hands or your feet? And he says, no. But like I said, on occasion, he said that pain goes into his low back. I say, okay, that's good. That's good to know. Any weakness in your arms or legs? And he says no. And so from there, what I've gathered is that I have a 45-year-old male in the clinic, low back pain. It's been on and off for a couple decades. Last couple months, it's been pretty significant. It's about an 8 out of 10 at its worst. It's about 5 or 6 out of 10 constant. He wakes up stiff in the morning. No radicular signs, so there's no red flags. There's nothing running into his legs. There's no immediate concern to get him to an emergency room for emergent decompression. And he's tried massage, he's tried heat, he's tried all the things, and now he's in my office because he saw a Google ad and wanted to try out chiropractic to see if he could get his back fixed. And so I said, okay, perfect. I think I have a lot of information here. And I asked, do you mind if I do a physical exam? And he says, you know what, doctor, I would really appreciate if you did a physical exam. So what I do, I start with my vitals. So heart rate is normal. What I look for in a resting heart rate is between 60 and 100 beats per minute, and passes with flying colors. He's about a 70, and that's pretty good for his age group. And respiration rate is between 14 and 16 breaths per minute. He's doing just fine. I use my little pulse ox to check pulse, and he's doing great. He has 98, 99% O2 sat, so he's doing perfect. And then I go to do a pretty thorough inspection. Now, for me, what I do is I just look at the face, I look at his skin color, look to see if there's any masses, lesions, discolorations, tattoos, etc. Any signs of any trauma? No signs of trauma. Passing with flying colors. Um, let's see. Whew. Then what I do is I'll have the patient, I'll run the patient through my range of motion, my ortho assessment, and my neuro assessment. Personally, I'm very big into doing a neuro assessment. So I start with my reflexes. So I have him sit, I check his upper extremity, lower extremity reflexes, and they're the same and equal bilateral. That's what I'm looking for, and he's perfect, passing so far. I check his myotones, his muscle strength, upper and lower extremity, passing with flying colors, but when he goes to lift his right knee, he has a bit of pain in that right low back, nothing shooting down into his leg, which is good. So his myotones, 5 out of 5, reflexes are 2+ out of 4, doing outstanding. Then I check his range of motion. So I have him stand up, face me, and while he's facing me, I'm checking his posture. So I'm seeing a bit of postural abnormalities. I see his right shoulder is a bit high. I see his head is a bit forward. His neck is a bit tilted to the left. I look from the side. I see he has a bit of an anterior pelvic tilt, which I'm not surprised with. And then I have him tuck his head, bring it all the way up, look all the way to the left, look all the way to the right, past flying colors. I have him go forward and touch toes. And as he goes to touch toes, he has pain going down and pain coming back up. And I say, huh, that's interesting. Okay, so my thought process is maybe ligament, it might be disc, it might be facet, it might be surrounding paraspinal musculature. You never know. We're going to test these things out. So going from there, I have him come back all the way up. And when he comes back up, he has pain as well. And so we continue. And I have him rotate to the right, rotate to the left. No pain with rotation, just pain coming back up and going down. So, okay. Then I do my ortho assessment. So I do all my ortho exams that are going to increase intra-abdominal pressure, and I make sure that, is it a disc? Is it not a disc? Okay. Well, he's in pain, but it's not, causing ridiculous pain. Okay. So then I do all my exams that are going to challenge the facet, and I say, okay, he has pain here, but it's really kind of hit and miss. Not all of them are adding up. So I say, listen, this guy, he's otherwise healthy. In my opinion, he's presenting with just non-specific mechanical low back pain. And I say, okay, let me just do a few more things. I'm going to have this individual lay down, and I'm going to feel all the way from the base of their neck all the way to their low back. And when I do that, I feel segmental restriction, upper cervical spine, mid-thoracic from about T3 to T8, restriction challenging from posterior to anterior. And then as he's laying on his stomach, I feel low back, and it's tender to touch from L4, 5, S1. So that lower lumbar spine. And I let this individual know, like these are all the things that I found. You have segmental restriction, upper cervical, mid thoracic, the lumbar. You're otherwise presented with non-specific low back pain. We're trying to challenge the facet. You have some positive findings with the facet. We try to challenge with intra-abdominal pressure to check if it's a disc, and you're kind of, here and there, but nothing is for sure positive. You're not having any ridiculous symptoms. So I say, listen, what I suggest is let me go through all these exam findings and come up with the plan and have you come back and I'll present you with the plan. So he says, fine, that's perfect. Thank you so much for taking the time and attention to come up with the plan, to see me. I really appreciate that. And so have him leave. He comes back next day, and I present him with all the things, and I present him with a plan. I say, listen, so what the plan is going to consist of is it's a trial of care. It's going to be a trial of care. We're going to do what we call chiropractic adjustments, which are the chiropractor, the doctor, bringing a specific range of motion into the joint where range of motion is lacking. So in hopes of keeping a healthy range of motion and allowing the spine to maintain proper mechanical function, right? And so we're also going to address weakness through exercise and rehab, right? So what I start off by doing is chiropractic adjustments, but I phase things out. And I say, we're going to do this for a couple weeks, okay? We're going to have 3 different phases for a couple weeks. What we're going to do is we're going to have a phase where we're going to bring in mobility through adjustments and exercise. Then we're going to do a phase where we strengthen through body weight, through band, through going to the gym, where and learning how to properly abdominal brace. And then we're going to have a phase where we continue with mobility, we continue strengthening, and we just go from there. And then by the end of it, you're rocking perfect. But I always say, we never know how people are going to respond, So it takes time. And it also, sometimes, we have to have a trial of care, and then we have to figure out, hey, listen, we have to head another direction. If this wasn't the direction that you're supposed to head in, what we do is at that point, we refer you to the right direction. But luckily, fast forwarding to the end of treatment, he flew through the mobility phase, did excellent. By the end of the mobility phase, after a few weeks, he was able to touch his toes and come back up pain-free. Then what we did was we added some strength. So we added dead bugs. We added McGill's Big 3. Then we did a phase where he did bodyweight squats, and deadlifts. And then he flew through that strong as could be. And then he got to the third phase, mobility and strength. And he flew through that. And by the end of it, we did a wonderful, big, all encompassing re exam. And guess what? Return to work better functioning than before. Return to work here